Hi everyone. Today we are going to discuss about how to read our lab results. Remember in our last video, I mentioned the need to get your lab before seeing your doctor during your annual physical. So today I'm going to show you how to read these labs so that you get yourself familiar with it, know what it is, know the ones that are not okay, so that when you are facing the doctor, if there is anyone that he or she is missing, you will be the one that will point it out to him or her. So as a disclaimer, I'm just letting you guys know that whatever information you're getting from here, please, it's not a replacement of your diagnosis or whatever is happening to you in terms of your health. It's just an information to aid you. And again, the lab that I'm showing is my own lab. I decided to use mine because it will be easier when you're looking at these numbers. You will know, get yourself familiar on how to use it. All right. So the first one is hemoglobin A1C, which is the average blood sugar for the past 90 days. Like I said, this is the standard measurement of knowing your diabetic status. The one that you prick in your finger is not always accurate because that will depend on the food you just ate. So mine is 5.7. So like you can see, anywhere below 5.7, you know you're good. But 5.7, I'm just at the borderline, while 5.7 to 6.4 is showing that you're pre-diabetic. Anywhere above 6.5, then it's a full-blown diabetes. You can also check the trend of this by checking it from year to year. The whole essence of these things that we're doing is for you to know how fair you're going as far as diabetes is concerned. As you can see on the screen from 2020 to 2025, you can see at one time in 2021, for example, I was at 5.4. And then in 2020, I was 5.7. But between, for instance, 2022, I climbed up to 5.8. And in maybe 2024, it was as high as 6.0. But I started coming down to 5.7 in 2025. So my goal now is to ensure that in 2026, I will come down more, probably to move up from the borderline to something like 5.6 or 5.5. So the whole essence of us doing this is to ensure that the next hemoglobin A1C is better than the previous year, so that it will help you a lot in managing your diabetes, not waiting until it is a full-blown diabetes, or even when you're already diabetic, say your hemoglobin A1C is 7.0, 8 point something. The whole idea is for you to ensure that you're bringing it down with all the practices like your exercise, your diet, and probably whatever the doctor must have put you on. So that is the essence of keeping, track of all this. The next one we're going to discuss is our lipid panel or our cholesterol level. Cholesterol is very, very important because high cholesterol and high blood pressure is like a first-class ticket to stroke and a whole lot of chronic diseases. So it's good for us to keep this number in check. Like you can see on the screen, cholesterol was 212. The normal number is supposed to be between 0 to 200. Mine is 212. And cholesterol, the total cholesterol has three major components. And these are triglyceride, good cholesterol or HDL, and bad cholesterol or LDL. For you to get the total cholesterol, you have to add the triglyceride, the good cholesterol and the bad cholesterol. But it's not just ordinary addition. You have to get 20% of the triglyceride, or you divide your triglyceride by 5. Then you add your good cholesterol, your HDL, and your LDL. You can see my HDL on the screen. Last year was 108. My LDL was 92. And my triglyceride was 59. So when you divide 59 by 5, or 20% of 59, you will get 11.8, which is approximately 12. So 12 plus 92 plus 108. That's how my total cholesterol came to 212. Although this number is above the normal range, but at least it's better than last 2 years, which is about 230. So I'm improving. And the whole essence of keeping this trend is that by the time I did my blood work this year, I'm going to see a number lower than 212, and I will continue to go from that trend. If you look at the graph of knowing my number from 2029 to 2025, you can see that from 2029, I've been below 200. But from 2023, I started shooting up above 200. And the whole essence is that by 2026, I will come back to where I used to be in 2029. So this is the beauty of looking at these numbers and following them very well. The next important lab that you should take note of is the electrolytes. And inside this electrolyte, we have the potassium. The potassium, you can see the range there, 3.5 to 5.3. And mine is 4.2. So if you're on any blood pressure medicine that is making you to pee, that's the diuretic, you keep an eye on this potassium level, because let's assume that mine is 3.5. Then I have to make sure that it's either my doctor puts me on a potassium supplement, or it gives me something that will be replenishing my potassium. Because remember that each time you pee, you're losing your electrolytes. So electrolyte goes out with some of this fluid that is going away from our body. The chloride level is 98 to 107. Mine was 97. Another important electrolyte to keep an eye on is your sodium. You can see on the screen the graph of my sodium from 2022 to 2025. The minimum sodium level is 135, while the maximum is 145. Mine was in 2025 around 136. You can see somewhere in 2023 it dropped lower than 135, and also sometime in 2025 as well. But I was able to increase a little bit of sodium in my food, and that's why it went back to normal. Another important lab to consider when you're checking your going for your annual physical is your kidney function, your BUN and creatinine. You can see the range of BUN 7 to 25, while your creatinine is 0.6 to 1.2. So these numbers, like I said earlier in one of my videos, don't rely so much on it. Be checking your urine, for instance. Like I said in that video, if your urine is foaming so much, then you might be considering seeing your doctor, because it's likely that your nephron, which are the filters of your kidney, it's getting faulty. So when they're porous, they always allow protein to pass through it, and that's what makes your urine to foam. So keep an eye on these numbers because they are very important. Another one that we have to consider is for men is the PSA, which is the prostate specific antigen. I'm going to go into details when we started discussing about some of these diseases in detail. Our PSA, like you can see on the screen, it ranges from 0.00 to 4.0, and this is age dependent. Like if you're young, you should expect your PSA to be low, and if you're old, like in your 60s, 70s, 80s, and 90s, then when you see a number in the high region, like 4 and a little bit above for 90 years, then you know that it's just normal. So these are the important labs that we mentioned. I talked about our hemoglobin A1C. I mentioned that electrolyte is also good for us to check. And then our lipid panel, which is our cholesterol. Then our kidney function, BUN and creatinine. And then PSA for men. And then women, try to remember to check your mammogram. Don't forget to like, subscribe, share it to your loved ones. Until I see you next time. Bye.